Hi, my name is Jen, and I'm going to talk a little bit about healthcare, but I've tried to do this video a couple of times, and healthcare is to me huge. So I'm going to break it into a couple of videos and try to keep it shorter so that it's not too uninteresting. Although, most likely, if you're watching this, you've got an interest in healthcare. So, number one, this is going to be, I'm going to try and limit my focus to primary care and hospitals. So, primary care, it's the devil's in the details, right? As platforms come out, the Green Party of Ontario was the first party to come out with a fully costed platform. The other platforms, I haven't seen them yet, so I can't really comment much on what the other parties are promising. Primary care. What I am seeing in promises, including from the Green Party, is to get IMGs or International Medical Graduates licensed more quickly. This is where could be important to ask your candidate or all candidates in your riding here in Canada Carleton, how do you plan to do this? And how long do you think it's going to take? Right? Because licensing IMGs is not going to happen tomorrow, right? Unless there's a process that's already going on in the back room somewhere, it's not going to happen tomorrow. I fully agree with this plan because it's just a grossly unfair situation as it is for IMGs and their families as well, but definitely for the IMGs. It's grossly unfair. It's a waste of talents. It's a waste of people who have a passion for the profession. And I speak, whether it's in this case doctors, but the same would be said for nurses, for PSWs, for engineers, for anybody who's graduated from professional degrees, right? Internationally. But I'll bring it back to IMGs. So the problem is the devil is in the details. When will we get these IMGs to work at the clinics? The other thing too, of course, is once IMGs do get approved, this shouldn't be an opportunity, as it appears to be right now, to pay them less than they're worth, because I believe that is what the hope is. But just as family doctors are not making enough right now, which is why many are either retiring early or trying to do, and I've seen this post so many times, they want to do something that's fun, and that pays more fairly. Um, yeah, like I don't want to see wage suppression occur when there are more IMGs licensed here in Canada, just for the privilege of working in Ontario or the rest of Canada. So the devil's in the details. With regards to Dr. Philpott's report, be cautious. Dr. Philpott, I have the utmost respect for her. I don't trust the Ford government. So keep in mind that the Ford government announced it was going to work with Dr. Philpott to come up with a report or a plan project for primary care in Ontario. That announcement was made late last fall when there were already rumblings that Ford wanted to call an early election. This is important. So this wasn't something that was years in the making. This was something that was done in the context of Ford keeping back billions of dollars from healthcare in Ontario. Okay, billions of dollars with a B. That is number one. Number two, it came in the context of Bill 124, which we'll talk about in a second in terms of wage suppression for nurses and other healthcare workers. And of course, it also came in the context of not remunerating doctors and other healthcare workers sufficiently. So be very cautious about the promise of Dr. Philpott's report. Her heart is in the right place. Ford's is definitely not. Okay. So let's talk about family physicians, right? So family physicians, it's always important to know that for fee for service, we can, like, I do a teeny tiny amount of walk-in where I bill OHIP, and I can bill a whole $37 and change when I see a patient, but that's not how much I take home, right? And whether it's one or three issues, $37. Whether I see the patient, order an x-ray, have to review the x-ray, have to call the patient, tell them I found pneumonia, for example, let's say it's a chest x-ray. Then I have to ask them about allergies, write them a prescription, fax a prescription through their pharmacy of choice. $37. Okay? $37 is what I can bill. But we don't take home $37. We then pay 20 to 30% in overhead. Then we pay our other overhead, which is our licensing fees and our malpractice. Then we pay income tax on the remainder, which is totally appropriate. 100% agreed with that. And so we end up taking home about $16 or $17 per patient. okay? Regardless of the severity, regardless of the length of time we spend with them, whether it's 5 minutes or 20 minutes. Um, so it's good to, let's talk about that. It's important. Most party platforms are not going to say this. The Green Party of Ontario does mention it. Doctor remuneration is important. And actually, one thing I will say for the Green Party platform, which I was not involved in writing, but I'm very happy to see, they talk about negation. So for anybody who doesn't know, if you're a patient and you're lucky enough to have a family doctor, and your family doctor said, please don't go to a walk-in because it won't it will hurt me financially or something like that. It's because it does. Right now, negation is if you belong to a doctor, or pardon me, you see a doctor who belongs to a family health organization, or FHO, FHO. If you go to a walk-in clinic, if you go to an emergency room, if you go to something happens and you have to go into hospital, then it is quite possible that the doctors in the walk-in clinic, emergency room, or hospital, if they're family doctors, they will bill for seeing you as a patient, of course, which is 100% appropriate. But negation means that OHIP will then subtract whatever they bill from what your own family doctor gets remunerated for having you as a patient. So it's a terrible system, and the Green Party of Ontario will actually scrap negation. So that's important, especially for doctors to know, but it's also important for everybody to know, because they're getting rid of something that is a huge, big negative. It's incredibly dissatisfying for doctors. We can't control, and we don't want to control, where our patients can go. And it's grossly unfair, though, that if somebody breaks a leg and ends up in hospital for maybe a day or so or whatever, let's make it pancreatitis, that's more likely to have hospitalization required, and they're treated by a family doctor. It's wonderful they're being treated and taken care of by a family doctor. The family doctor, who's actually the patient's normal physician, should not be dinged financially just because of life and what can happen to people. So that's negation. I just wanted to mention that. The other thing too is, let's talk about nurses for a second. Bill 124. Bill 124 came out in 2021 or 2022. At first, I'll be honest, I thought it was maybe incompetence, because Sylvia Jones was a new Minister of Health, and she'd only been in the job for a couple months when Bill 124 was announced, I believe. So I thought maybe it's incompetence. But after a few months, and nurses complaining about the wages, because for the record, Bill 124 is a bill that limited nurses and other healthcare workers from wage increases of any more than 1%, which does not even keep up with inflation, right? So Bill 124, nurses were complaining, hospitals were complaining because they're losing nurses in droves, and the Ministry of Ontario didn't do anything. And so at that point, I realized this is intentional. They are trying to break the publicly funded healthcare system. And sure enough, they were. What I didn't realize, but what I learned at an OPSEU, which is a union talk or town hall, was that they're also union breaking. Because what would happen was the nurses were very dissatisfied, as they should be, and other healthcare workers, with a 1% increase. And in the case of nurses, they started to restrict their working hours. And then because conditions were so poor, because they were so short-staffed, they were leaving the hospitals, joining travel agencies or companies. The travel companies would then contract with the hospital, the same hospital, send the nurse back, better paid. He or she would get a pay bump. The agency gets a huge cut in terms of administration, because they're providing the nurse to the hospital. And the hospital is now paying much more for the nurse than they ever did when the nurse worked directly for them. So it's also a form of union busting. The other thing too is it puts that whole situation has put hospitals into deficit positions, to which the Ford government turned around and said, no, we're not going to give you more money to operate your hospitals. We don't care. You have to put up and make do with what you've been given. So it's been just bad news all around. So I wanted to talk about that because it's so important that nurses and healthcare workers be remunerated appropriately, because otherwise we don't have them. Right? So we can decide as a population and as a community here in Canada Carleton that, doctors and nurses and healthcare workers shouldn't be paid that much, or they should work for free, because of course everybody else wants to work for free, right? No. But the issue is that if we make that decision that we don't think nurses and doctors and healthcare workers should be paid their worth, then we're just not going to have them, right? And that's where the privately funded healthcare system comes in. Because the other piece, well, the Ford government has been working to basically destroy the publicly funded healthcare system, and of course, has been granting nice, favorable status to privately funded healthcare, right? So, and you can look at the Shoppers Drug Mart, and medical clinics cropping up in Shoppers Drug Marts and in Loblaws and that sort of thing. That's what one of the special agreements that's been going on. If we look at ophthalmology clinics, there's been some ophthalmology surgical clinics that have been opened up that are, privately run and publicly funded to an extent where you can use your OHIP card. And originally we were hearing that people wouldn't have to pay at all to go to these ophthalmology clinics. And that turned out, of course, to be wrong as people started to report and complain to the news that, I went in for eye surgery. I had to pay this much. Yes, I used my OHIP card, but then I paid this much for a specialized test that wasn't covered by OHIP. I had to, and I had to pay for these special lenses to the tune of several hundreds of dollars or thousands of dollars. So, and also these privately funded healthcare clinics have been getting special deals, and funding from the Ford government, much less than what's being offered to the publicly funded hospitals to do the same surgeries. So there is something significant going on. So I'll just try to sum up healthcare from a primary care and hospital perspective is that please look at the platforms. Please ask your candidates if you have questions about healthcare and try to get the details about it. Because there's obviously going to be some misrepresentation occurring because it's an election. Do you value the question is really, do you value publicly funded healthcare or not? And if you do, please just look at the platforms and ask the questions and expect, informed answers that are actually plausible. Thank you very much for listening to this and have a good day.